Good evening, madam. My name is Xiao Sijing. I'm from Science 1, June 2022, PPISMP. In this video, I will play the role as a doctor.
Good evening, madam. My name is Bok Hui Ning from Class Science 1, PPISMP, June 2022. In this video, I will play a role as a pharmacist.
Good evening, madam. My name is Daniel Ting from Class Science 1, PPISMP, June 2022. In this scenario, I act as a police. The scenario is a police arrested some drug addicts at a night party, and this is the discussion among a police, doctor, as well as a pharmacist. The scenario is begin. Good evening, Miss Xiao and Miss Paul. I would like to know about drugs as I just arrested some drug addicts at a night party.
Nowadays, many types of drugs have been explored worldwide by scientists. Drugs are chemical agents that uniquely interact with specific target molecule in the body and produce biological effects. There are 4 types of drugs: stimulants, hallucinogen, inhalants, and also depressant. The rules of dosage, timing, and also prescription from a doctor are significant to ensure that we can administer the different classes of drugs in the right ways.
Exactly. The route of administration is determined by the physical characteristics of the drugs, needing to bypass hepatic metabolism and achieve high concentration at particular sites.
Can Miss Paul describe briefly about the process of drugs in our body?
Sure, the drugs, when entering our body, will be absorbed from the site of administration to systematic circulation, and it will be transferred from the systematic circulation to tissue. This will give effect to neurotransmitter and will undergo biotransformation mainly by the liver. Lastly, they are excreted through renal or hepatobiliary system.
Oh, thanks for your explanation. Besides that, I also wanted to ask you to check to see what sort of substance is this.
First, may I know what features do the drug have?
This drug is typically a white, pink, or gray or yellowish powder. It comes packed in small plastic bags and have a pungent aroma. Could you kindly assist me in determining what kind of drugs is this?
Oh, I see your points. However, can you describe more about the features of these drugs?
Sure. The drug addicts intake the drugs by injecting, blending into a beverage, and snorting up into their nose. It also tastes bitter. After consuming the drug addicts will undergo euphoria. I have brought some samples here. Now,
Based on your description, I strongly believe that these are stimulants. However, I need to carry out some tests to identify the chemical properties of the drugs. This is because the drug may be a combination of several compounds. This test can also be an evidence to prove my assumption. I will investigate the samples and tell you the results in 2 days.
Stimulants, I think I have read the article about stimulants before this. Based on that article, stimulants intended usage can lead to misuse and reliance. Just like with other prescribed medication, it might be challenging to recognize the moment someone's usage of stimulants has crossed the line into addiction. These typically red flags and symptoms of amphetamine addiction include headaches, anxiety, restlessness, weariness, sadness, financial problems, and other symptoms of these conditions.
So, what is the average age of the people you had arrested?
Most of them are teenagers, as many teenagers think that stimulants can increase IQ. But they're wrong. For the purpose of enhancing cognitive functions, some persons use prescription stimulants. They are occasionally abused by teenagers and college students in an effort to boost their grades, as well as by elderly persons in an effort to boost their memories.
If prescription stimulants are used for conditions other than treating the ADHD or narcolepsy, side effects like addiction, cardio issues, or psychosis may result.
Oh, so can I know how are the stimulants used and abused in the young people in night parties?
Well, the majority of the prescription stimulants come in oral pill, capsule, or liquid form. When a prescription stimulant is misused, it is taken in ways of doses that are not recommended. It is used by someone else and it is taken for the high it produces. People can also ingest the drug in its regular form when abusing a prescription stimulants. Alternately, they can break out the pills or open the capsules, mix the powder with some water, and inject the resulting solution into their vein. Some people can smoke or snort the powder.
Oh, I get your point. Frankly speaking, drug addiction is easily developed in people. The initial decision to take drugs is voluntary for most people. But repeated drug use can lead to brain changes that challenge an addicted person's self-control and interfere with their ability to resist intense urge to take drugs.
You are right. People develop a tolerance to stimulants over time by using them often. When this occurs, your body needs bigger dosage to provide the same effects that it formerly did. It's a risky loop that before consumers even recognize it quickly results in addiction.
I agree with your view. According to the World Health Organization, WHO, more than 180,000 people were linked directly to drug addiction in 2019. This is because people do not know what impact will bring to them after consuming the drugs.
Yes, even over a short length of time, stimulants addiction frequently can result in psychosis, rage, or paranoia. The chance of developing infectious illnesses like HIV and hepatitis increases if the drugs is injected, and it's vital to remember that sharing drug injection equipment and having poor judgment from drug abuse can contribute to this risk. During prescription, can we intake stimulants in a large amount? Is it possible to happen?
Well, it is possible to overdose on stimulants within the first several uses, or even when taken as prescribed, as happens in rare cases when people are prescribed Adderall or Ritalin for ADHD. A stimulant overdose is typically a sign of a substance use problems. If you go to emergency room for a stimulant overdose, then continue to use the stimulants, it's certainly a sign of a substances use problems.
Restless, quick breathing, hallucinations, and panic states are among the symptoms of the overdose of drugs. They could also experience circulatory failure, unusual high or low blood pressure, and nerve issues that can cause a seizure on them.
Thus, it is very dangerous to overdose stimulants. When we see a person who has overdosed and undergoes these side effects, the most crucial action is to dial 911 so that a person who has overdosed on a prescription stimulants overdose frequently results in a heart attack or seizure. First responders and emergency department medical staff attempt to treat the overdose with the goal of reviving cardiac blood flow and, if required, ending the seizure with care and medicine. So, how about if a patient is facing many diseases and need to receive more than one type of medicine?
This situation, our doctor will know it as comorbidity. It defines the simultaneous presence of multiple disease or conditions in our body. Comorbidities are typically chronic or long-lasting in our body. In this case, the patient should inform their doctors of all of their medical background. This will enable the doctor to plan a more concerns, and this is because the doctor can develop a more concerned treatment strategy that meets their preferences, tolerance, and requirements.
Definitely, prescription drugs dosage need to be at the optimum dose without causing an adverse effects. Patients with advanced illnesses receive more than one type of medication. These conditions increase the risk of drug interactions. To overcome these problems, a preclinical test is carried out to analyze the bioactivities, safety, and also efficiency of the formulated drug products.
Yes, I agree with you, Ms. Pop. Preclinical test is to function as assessing the toxicity of a drug and examine its potential effects on the human body.
Yes, the tests are conducted in vitro and also in vivo. This is to ensure that a drug is safe for human use prior to start human clinical trials. In vitro testing in a controlled environment, while in vivo trials involve in pharmacokinetics and also pharmacodynamics studies to ascertain the drug's mechanism of action. Preclinical tests can ensure that the efficiency of a medicine would not cause other side effects when combined with other types of drugs, as the patient need to consume more than one medicine.
Thanks for your info. At this time, amphetamines are one of the drugs which are commonly found in the community today, especially in the nightclubs and parties.
Amphetamines is classified as stimulants. Drugs in the stimulant class hasten the transmission of signals between our body and our brain. As a result, drugs can give a great impact to our nervous system, such as controlling our feelings.
Can you explain more about the nervous system?
Yeah, of course. The nervous system is made up of two major parts, which are central nervous system, CNS, and the peripheral nervous system, PNS. Each instruct our body how to behave by transmitting and receiving electrical impulses. Hence, we can move our limbs and control our movements. Neurons also control our body's automatic functions such as breathing, shivering, and maintaining a steady heartbeat.
Before you go on, may I ask about the differences of central nervous system and the peripheral nervous system?
Yes, our central nervous system is made out of our brain and also spinal cord. Our nerves are used by our brain to communicate with the rest of our body. A layer of protections called myelin surround each nerve. Myelin protects the nerve and also act in the transmissions of signals.
On the other hand, our body's peripheral nervous systems is made up of several nerves that branch out from our central nervous system, CNS. Our organs, arms, and legs receive information from our brain and spinal cord through this system. In our peripheral nervous system, there are somatic nerve cells which control our voluntary actions, and the autonomic nervous system, which is responsibility for controlling our involuntary emotions.
Now I only know the importance of the nervous system. Thus, what should we do to maintain our nerves health?
First, we should visit the doctor frequently and maintain a healthy diet. The most important way to prevent this is consuming less alcohol or products which contain drugs. This can avoid the alcohol which contains drugs from harming our nerves.
Yes, I strongly agree with you. Stimulant use, even a short period, can be harmful to our health. A loss of appetite, increased heart rate, high blood pressure and body temperature, disturbed sleep patterns, panic attacks, hallucinations, and irritability are common side effects reported by the users.
That's right. Relate to amphetamine. Amphetamine has powerful central nervous system, that is CNS, stimulant actions. In addition to peripheral actions, typically of indirect sympathomimetic drugs. Main effects of acute administration are wakefulness, decreased sense of fatigue, elevations of mood, and increase the ability to concern. Amphetamine also suppresses appetite. The uses of this drug is caused by its effect towards the nervous system and also the neurotransmitter.
Amphetamines boost our dopamine and norepinephrine neurotransmitter system's synaptic activity. Dopamine is a sort of neurotransmitter and hormone. It affects a variety of vital bodily processes such as mobility, memory, and rewarding pleasure. During consuming amphetamines, our axon terminals will release dopamine. At the same time, amphetamines prevent dopamine reuptake at synapse and from being stored at vesicles. This eventually stops dopamine from being destroyed by enzyme. Thus, more dopamine can now act on the receptors in the postsynaptic cleft and causes a feeling of happiness in us, which is euphoria.
Thanks for the explanation on how amphetamine affects our nervous system. However, what causes people these days to consume amphetamines?
Nowadays, amphetamines are used in the medical and recreational field. In the medical field, amphetamines can safely treat some medical disorders such as narcolepsy, where the patient is unable to prevent falling asleep at random times, is treated with dexedrine, which is also known as dexamphetamine sulfate. Besides, attention deficient hyperactivity disorder, ADHD, is treated with methylphenidate, which is Ritalin. Furthermore, amphetamines may also very rarely be used to treat obesity and some types of depression that do not improve with other forms of therapy. While recreational use, the amphetamines is used to enhance performance or get high without a prescription. These drugs are called street or recreational drugs in the community.
So, Miss Deng, I have something to ask. What are the treatments will you take for the drug addicts?
Some treatment program, such as counseling, will be carried out for them. The goal is to help us understand their behaviors and why they use amphetamines. This talk or therapy will involve their family members and friends during counseling. This is to help to support them and avoid them from going back to use. If they have severe withdrawal symptoms, they may need to stay at a live-in treatment program. Their health and safety can be monitored. At this time, there is no medicine that can help to reduce the use of amphetamines and block their side effects.
Sorry for interrupting. I would like to end on some opinions. Precaution to prevent relapse on the drug addicts are also crucial. We should make sure that the drug addicts attend their therapy appointments as scheduled. In addition, the drug addicts should also eat well-balanced meals and exercise regularly to practice a healthy lifestyle. By taking good care of themselves, aids their body's recovery from the negative effects of drug use. In this case, they can live healthily and happily.
Yes, I agree with both of your opinion. Medication also can play an important role in recovery when combined with behavioral therapies. Certain medications can be used to reduce cravings, improve moods, and also decrease the addictive behaviors. For example, the FDA recently approved lofazidines and also to help in treatments for opioid addiction.
Thank you for sharing such a good opinion. Now I can understand that other methods to carry out the treatment toward drug addict. Let's move on to another part about excessive medicines. So, do you guys have any methods to overcome the excess medicine?
Yes, you all have heard about the drug recycling method.
Definitely.
Yes, but I just have a sense amount of knowledge about that.
So, before I go further, let us discuss some informations about the correlations between the medication and also the society. Nowadays, we are facing drug-related societal problems such as higher pharmaceutical costs, the high price of drugs, and also shortage of drugs. Moreover, the excessive drugs that are expired and stored by patients after they stop consuming the medicine might cause illegal business about drugs.
Oh yeah, recently I discovered illegal drug sales online. I think this may be caused by the incorrect way to deal with the drugs.
Yes, our patient in the hospital is also facing excessive drugs problem. Usually, there are several factors causing excess medicines, which include the patient has passed away, get the medicine from multiple sources, stop taking medicine when the patient is feeling better or due to doctor's advice, did not take medicine as instructed by the doctors, changes in the treatment regimen, or forgot to take the medicine. This eventually causes them to store the drugs in a large amount.
Yes, normally people can get their medicine from long-term care pharmacies, retail pharmacies, and in consumer medicine cabinets. Government and pharmaceutical companies will routinely toss out tons of scarce and potentially valuable prescriptions drugs when they hit their expiration dates and cause lots of money waste. Excess medicine can lead to risk of medication errors.
Yes. People may accidentally consume expired medicine, wrong dose, or wrong type of medicine due to damage levels. So, children has high risk of getting medicine overdose that can lead to toxicity.
Yes, besides the side effects of drugs that aspire towards neurotransmitters, the illegal business of drugs through several methods will cause the risk of getting disease and damage to the nervous system. So, the drug recycle method is used to overcome these problems because some active ingredient in those drugs is still potent and also stable.
I really agree with your opinions. I have gained this idea and topic from an article which was written by Marshall Allen that was named The Myth of Drugs Expiration Dates on July 18, 2017. In this article, majority drugs were still safe to use even 15 years after their expiration dates. If the medicine is kept in a cold environment, such as a refrigerator, it can last for more years, and the effective of the medicine will also not decreases.
In his article, he also mentioned the findings by pharmacists, toxicologists, and also researchers towards the expired date drugs. After managing many types of research and also experiment, they finally found out that active ingredients in those expired medicines are pretty stable, thus refining our prescriptions drug dating process could save billions.
Yes, before we continue our discussion, I think we can slow down a bit for our discussion as we have plenty of time to discuss about this topic. Okay, so I've done research about that for investigational use. In some countries, drug recycling programs operate successfully by donating unused drugs to the less fortunate. In the United States, drug recycling programs exist locally. As of in 2010, Canada had fewer drug recycling programs than the United States.
Absolutely. These programs occur in specific pharmacies only. Since these pharmacies are prepared to address the special requirements of participating in a recycling program. Usually, drug returns happens without financial compensation. In Greece, the organization GIV MED, do you have ever heard this?
I think I didn't heard it before.
Yes, so I will continue. The GIV MED operates in drug recycling and save over €500,000 by recycling almost 660 care drug package since 2016.
However, in other countries such as Canada, implementations of drug recycling programs are limited. these countries focus on other initiatives which are donating drugs to the third world countries such as Malaysia.
Maybe.
I think so. This is a company with ethical constraints due to uncertainties in quality, as well as practical constraints, as making the drugs only temporarily available and not necessarily addressing local needs.
Yes, the World Health Organization provided guidelines on appropriate drug donation, thereby discouraging donation practice that do not consider recipient needs, government policies, effective coordinations, or quality standards.
Alternatively, drug recycling programs could be set as routine clinical practice with the aim of reducing the economic and also environmental burden of medication waste. Still, for general implementation of drug recycling programs, clear professional guidelines are required. For example, research towards that a majority of patients is willing to use recycled drugs if the quality is maintained, and explore requirements for a drug recycling program perceived by stakeholders, including the general public, pharmacists, and also the policymakers.
Yes, I agree with you, Ms. Park. I think I see some pharmacies is also carrying out this drug recycle, and I hope that it is.
It is.
Sorry, I hope that it will be a more popular activity
Yes, yes.
in our community these days. From an economical perspective, if the savings exceed the operational pharmacy's cost, implementation of drug recycling is encouraged as routine clinical practice. In the Netherlands, redispensing of unused oral anti-cancer drugs is currently tested in routine clinical practice to determine cost savings of a quality control process. This data could help policymakers to prioritize drug recycling on their agenda. Therefore, guidelines for general implementation of drug recycling will be facilitated by the governments.
Yes, your point is
Really good.
Yes, very good, very good.
Very clear opinion.
Yes.
Thank you.
So, for this discussion, I would like to make a conclusion. So, drug recycling methods should be used worldwide to ensure that the illegal business toward expired drugs and increase the awareness of people
Yes,
toward
that's
using
right.
yes.
The awareness of people is the most important.
Yes, if they do not have the awareness, our country is happy.
Yes,
Yes, you're right.
the drug recycling should explore worldwide by
By our country.
yes,
Yeah.
by our country.
So, I really, do you heard that our country have the increased cases of drugs addiction?
Yes, definitely. I heard the
News.
news. Yes, the news.
In our country
Yes,
has increased because of
because of their
Because of the stress of the
Ah,
teenagers.
and
They cannot control
the
their
parents
self.
do not pay attention of
of their feelings,
Yeah.
like
Yes.
maybe forcing them to have tuition class, to
Ah.
go to tuition classes, and this may causes them more stress and need to be relaxed by consuming some drugs, and eventually after they taking drugs, they will feel like a feeling of happiness, like euphoria, and this eventually release their stress, and by the time they taking the drugs, they will have like drug addiction because they will just depends on the drugs and can't
Can't live without it.
yes, and it's very difficult to have treatment, not to have treatment. It's very difficult to stop from using drugs. So I think that in schools or government or parents should give more attention to their children or teenagers nowadays, so that they can live in a more happy and healthy environment.
Yeah.
Yes, based on Miss Tang's opinion just now in our conversation, Miss Tang has said that some teenagers they thought that consume the stimulants can increase their IQ. Yes, is it correct?
No, it is totally wrong.
Yes.
Actually, the drugs just that the stimulus just bring them to a higher.
Just speed
Higher
up the
mood.
neurotransmitter
So
only.
it is
Just temporary.
not long
No
term
long-term
effect.
effects.
So it is not good actually for the health.
But they were taught that all stimulants is very good, and I just want to eat, and I will become very clever and get 10 A plus in SPM.
Because their parents force them to get excellent results.
Yes,
must get
it's very
excellent
stress,
results.
you know.
Yeah, stress A plus. It is,
Yes.
Yeah, it make them very stressed.
I think this is also because of their misunderstanding of taking drugs. For example, they read through or browse through the internet, such as social medias like WhatsApp, Instagram, and Facebook.
Yes,
What do you think?
I really agree with you.
Yes, and actually, the teenagers who are addicted to the drugs or stimulants like this is actually causing financial problems because these drugs is
Quite expensive for them to have.
so they might steal the
Or
money
they
from the
can
parents.
just buy the drugs through the illegal business, you know. Just like yes, they will just lay to just make a very attractive sell to others.
Sometimes the public, or no, not the public, the owner of the illegal business may also like
They can sell the drugs very very
make
cheap.
they actually they are selling the drugs, but
the drugs may be fake for them.
yeah,
Yes.
so that things may be dangerous.
And they will sell the drugs that already expire very cheap, and they can get
Get no profit.
Yes,
even
get-
Yeah.
yes.
So yeah. I really appreciate our conversation today, and thank you very much for such an opinion. And sorry if I have made my if I
Any
have
mistake.
sorry I have made any mistakes. Yeah.
So it is my pleasure to share the information about the drugs. And in a nutshell, the risk of drug relates to the strength of dosage use. Nevertheless, we should use different types of drugs wisely and also properly to reduce the risk of using drugs. We also need to ensure the safe usage of drugs. And this can help us to build out a healthy community in this world. Healthy community is very important.
Because it is related to our next generation, whether they can live healthy or they are
To build
just
out a country that is
strong enough.
Yes, without
protect
any
them.
without any illegal business of drugs.
That is too dangerous.
Yes,
Just
For
we
them.
should use the drugs properly, and because drug will give many benefits to us when we use properly and wisely.
Yeah. So we need to take care of
When
ourselves.
we overuse those drugs, it will give such a bad impact to us.
As a doctor, my opinion is if the people or the public want to intake of the drugs, they should get to the doctor and ask them the correct dosage of the drugs to prevent them from overdosing, as it is very dangerous for them. This is because overuse of drugs can lead to a lot of side effects for them, such as seizure. In this discussion, I really agree with both of your opinions, and I'm very happy to have such discussion with you guys today. Your opinions are very helpful and valuable for me. Last but not least, people who consume drugs, no matter for medical or recreational use, should get advice from a healthcare provider that I just mentioned just now about the dosage.
Must follow the prescriptions of doctor.
Yeah, we cannot
Just use
make
the
it
drug.
By our own, like being the doctor by yourself,
that is
very popular issues in the community today.
Yes.
Besides that, I think that the hospital or the government should also make their effort in educating the community today to use drugs properly or wisely.
Especially for the patient, right?
Yeah, that's correct. For example, the hospital can organize some seminars about the drugs, and so that they can know about the benefits, the pros and cons of using drugs.
Hospital also can make a hotline center.
so that if they have any problems, they can
Directly just contact the
so they can
hospital.
help them anytime and anywhere.
Yes.
They can provide the most professional knowledge.
effective.
So they can get help.
Yeah. Besides that, using hotline center from the hospital is more, it's more good than just search in the internet nowadays and taking the information that we do not know it's correct or not and
Yes.
apply in our daily life.
Just like the drug recycling methods, how we want to spread them so that all of us know about the drugs. So in my opinion, I think we can make a campaign, just like return your medicine. It also can make the hotline center just like the hospital to make everyone have the knowledge about drug recycling method, because it is very significant. Yes, do you agree?
Yes, I agree with that. And then we can also, like, if you return extra drugs to us, and then we can give you some gifts, special
Rewards.
gifts,
Yes.
so that they will think like, it's
They are more
they are more active in this, and in this case, it's eventually encourage the public to involve in this
Two-side
campaign.
efforts.
Yeah, like win-win condition lah. Okay. So, our community can gain a lot of information in drugs if the governments, hospitals, or schools, or parents
They
put
collaborate.
collaborate and make efforts in educating the generation
the young
nowadays.
generation, yeah.
Yes, it is very important.
So, I really thanks you two spend your time, help me to
Yes, it's our
say-
pleasure.
solve my problem and tell me about so many knowledge that I
We
useful
also
to me.
gain
Yeah.
a lot of knowledge from you. Just like the teenagers then arrested at night
illegal
party,
sales online
illegal business.
from criminals. You help us a lot.
Okay, so
Widen our knowledge.
let us end our discussion and
Have a nice day today.
Okay.
Yeah. Okay.
Bye.
So thank you and
Thank you.
bye.
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 Bye.